Every single day, millions of people take medication thinking it's making them healthier. But what if I told you? Some of the most common drugs in your cabinet may actually be increasing your risk of a heart attack. In the last year alone, researchers and cardiologists have raised the alarm on several medications quietly linked to heart complications, and in some cases, fatal cardiac arrest. Before you pop your next pill, you need to see this. According to recent studies published by the American Heart Association and data from international pharmacovigilance databases, certain prescription and over-the-counter drugs have been tied to a rising number of heart attacks in people over 40, and even some under 30. This isn't fear-mongering, it's fact, and some of these medications are taken by tens of millions of people every day. Let's break down the biggest culprits. 1. NSAID and nonsteroidal anti-inflammatory drugs. Ibuprofen, naproxen, Advil, Aleve. Why it matters. Overuse has been linked to increased blood pressure and arterial constriction, both precursors to heart attack. 2. Stimulants for ADHD. Adderall, Ritalin. Why it matters. These medications increase heart rate and blood pressure. In susceptible individuals, especially with undiagnosed heart conditions, this can be a ticking time bomb. 3. Certain antibiotic, especially azithromycin, Z-Pak. Why it matters. Some studies suggest they can cause dangerous arrhythmias in vulnerable people. 4. Proton pump inhibitors, PPIs. Omeprazole, Prilosec, esomeprazole, Nexium. Why it matters. Long-term use has been linked to a higher risk of heart attack, possibly due to magnesium depletion and blood vessel damage. 1. Hormonal medications, including some birth control pills and testosterone boosters. Why it matters. These can increase clotting risk, which can block arteries and trigger a cardiac event. You might be wondering, if these drugs are so risky, why are they still available? In many cases, the risks are buried in the fine print. Pharmaceutical companies must list side effects, but that doesn't mean your doctor always explains them. And most people don't read the 6-page leaflet that comes with their med. Plus, the benefits often outweigh the risks, especially when used properly. But when misused, or when prescribed to the wrong person, it can end in tragedy. If you're currently taking any of these medications, don't panic. Here's what to do. Talk to your doctor or pharmacist. Ask about heart-related side effects. Get your blood pressure and heart checked if you're on long-term medication. Avoid stacking risky medications. For example, combining NSAIDs with stimulants. Watch for symptoms. Chest pain, dizziness, irregular heartbeat, and shortness of breath are red flags. Many different drugs can lead to heart damage. They each do this in different ways. Cocaine and methamphetamines are some of the riskiest drugs for your heart. They put you at risk for heart attacks, heart failure, and heart rhythm problems. Cannabis use can cause heart disease and strokes too. Signs of heart damage from drugs include chest pain, shortness of breath, a racing heartbeat, and swelling in the leg. More than 1 in 10 people who are hospitalized with serious heart conditions have illicit drugs in their systems. And different types of drugs can affect your heart in different ways. Some drugs, like cocaine, are more dangerous than others and can lead to heart attack. But many people are not aware how substances like cannabis, marijuana, and alcohol can also lead to heart disease. So, if you or someone you know uses substances, it is helpful to know the signs of heart damage. Cocaine and methamphetamines, meth, are some of the most dangerous drugs when it comes to your heart. This is because they have a direct effect on your heart and blood vessels. These drugs work by stimulating your sympathetic nervous system. That means they can raise your heart rate, increase your blood pressure, increase the risk for heart rhythm problems like atrial fibrillation, cause the arteries in your heart to go into spasm. When your arteries go into spasm, it can block blood flow and oxygen to your heart muscle. These spasms can also injure the lining of the arteries. And over time, that repeated damage can also lead to heart attacks and heart failure. Overall, cocaine more than doubles your risk of a heart attack. That is especially true if you are under the age of 40. Meth triples the risk. And if you use more substances, like tobacco, alcohol, or cannabis, your risk may be as high as 9 times normal. But it's not just your heart. These drugs may also affect other blood vessels in your body. That includes your aorta, the large artery that takes blood from your heart to the rest of the body. Damage to the aorta puts you at risk for an aortic dissection. This is often fatal. It's also important to note that the arteries that feed your brain can also be damaged by cocaine and meth. As a result, you are more likely to suffer a stroke. People who inject drugs, of any kind, into their veins are at higher risk for a condition called endocarditis. Endocarditis is the medical term for an infection inside the heart. This can lead to permanent heart damage. From the heart, the infection can also spread to the brain and other organs. Endocarditis happens because the needle or the injected substance is not sterile. That means that bacteria can be injected along with the drug. The heart is a common place for the infection to settle. From there, it can grow and destroy the heart valves and other heart structures. Endocarditis is a medical emergency. It almost always requires hospitalization and strong antibiotic, and some people may need surgery to replace the infected valve. If you do use injectable drugs, using sterile needles can cut your risk of endocarditis. Opioid overdoses are the leading cause of death for adults in the U.S. aged 25 through 64. At high doses, opioids might slow the heart rate and lower the blood pressure. But the main way that they cause harm is by slowing or stopping your breathing. This means the heart, brain, and other organs will not get enough oxygen. This can lead to permanent heart or brain damage. This is why naloxone, Narcan, can be life-saving. It quickly reverses the effect of opioids, so someone starts breathing normally again. This can restore oxygen to the body and prevent serious complications or death. It is also important to know that methadone can cause heart problems. Methadone is a lab-made opioid that can help people recover from opioid use disorder. But in high doses, it can cause heart rhythm problems. These conditions are called ventricular tachycardia and ventricular fibrillation. When you combine methadone with medications like benzodiazepines and other drugs, it can raise the risk for these problems. That's why it's important to take methadone under medical supervision. About 1 in 6 people in the U.S. have used cannabis in the past year. It is available legally to some extent in 38 states, as of 2023. But many people do not know that cannabis can impact your heart health. When you use cannabis, it can lead to a 34% higher risk for coronary artery disease, higher blood pressure and heart rate, especially right after using it, increased risk for atrial fibrillation, dangerously low blood pressure withstanding, known as orthostatic hypotension. A recent study in over 400,000 U.S. adults found that using cannabis daily increased risk of heart attack and stroke by 25% and 42%, respectively. This increased risk was present even in people who had never smoked tobacco. Even though it is legal across the country, alcohol is still a substance that can impact your health. Many people enjoy alcohol in moderation. Most people can enjoy 1 drink or fewer per day without any impact on the heart. But if you drink more than that, you may raise your risk for high blood pressure, atrial fibrillation, congestive heart failure, high triglycerides. Fortunately, the heart will often recover when you stop drinking alcohol. Symptoms of heart damage can sometimes be hard to tell apart from symptoms of a cough, cold, or fatigue. That's why it's important to talk to your primary care provider if you have any of the symptoms listed below. It can be scary to talk to your provider about new symptoms and substance use. But remember, they are there to help you, no matter what the cause. And many heart problems from drug use can be treated and cured before they become a bigger problem. Symptoms that may be signs of heart damage include chest pain, shortness of breath, coughing, inability to lie flat, heart palpitations, fevers or chills, headache, swelling in the abdomen, feet, or legs. Unusual fatigue. Can your heart recover from drug use? Some heart damage from drug use can be permanent. For example, if your heart muscle becomes weak from cocaine use, you may have permanent heart failure. Other conditions, like atrial fibrillation from alcohol, may go away when you stop drinking. But no matter what type of heart condition you have, it is treatable. In most cases, there is something your medical team can do to make you feel better. And when you stop using drugs or drinking alcohol, your heart can begin to recover. So, asking for help with drug use is the first step that can make a big difference down the line. Modern medicine has saved millions of lives, but it's not perfect. The key is knowing the risks so you can make better, safer choices for your body. If this video opened your eyes, share it with someone you care about. You might just save a life.